now we're going to talk about the thorax. The thorax is a region that lies between the neck and the abdomen. The thoracic cavity and the abdominal cavity are separated by the diaphragm. And here on this model we can very clearly see the diaphragm. This is the diaphragm. It's a muscle. Okay, so now let's go back to the skeleton. Now let's talk about the thoracic cage. Okay, this is the thoracic cage. All of that. So let's see how it is formed. Posteriorly, the thoracic cage is formed by the bodies of the 12 thoracic vertebrae. Okay, so this is the first thoracic vertebra, all the way down into the 12th thoracic vertebra. So the bodies of the 12th thoracic vertebrae form the posterior part of the thoracic cage. The lateral parts or the sides of the thoracic cage are formed by the ribs. We've got 12 pairs of ribs. This is the first rib all the way down into the 12th rib. This is the 12th rib. So we've got 12 pairs of ribs. All the 12 pairs of ribs form the sides of the thoracic cage. And anteriorly, the thoracic cage is formed by the sternum and the costal cartilages. Okay, so now this is the thoracic outlet. It provides passage for some major vessels. Thoracic outlet. Alright, so now let's talk a little more detailedly about each part of the thoracic cage. So beginning with the sternum, the sternum is divided into three major parts. The manubrium of the sternum, which is also called the manubrium sternae, body of the sternum, and the xiphoid process. This is the suprasternal notch. Suprasternal notch. This is the sternal angle. It's also called angle of Louis. This is the xyphosternal joint. Xyphosternal joint. It's important to know the relation between the parts of the sternum and the thoracic vertebrae. So firstly, the manubrium sternae is at the level of the third and fourth thoracic vertebrae. Okay, so this is, see, like that. This is the third, if you can see. This is the third thoracic vertebra. If you can see the number, it says third, and below is the fourth. Okay, it's like that. This is the upper part of the manubrium is in line with the third vertebra, thoracic vertebra, and the lower part is in line with the fourth thoracic vertebra. Okay, so the manubrium sternae is at the level of the bodies of the third and fourth thoracic vertebrae. Next, we've got the sternal angle. The sternal angle is at the level of the intervertebral disc between the fourth and fifth thoracic vertebrae. See, this was the fourth thoracic vertebra, and this is the fifth thoracic vertebra. In between is the intervertebral disc. Okay, so the sternal angle is in line or is at the level of the intervertebral disc between the fourth and fifth thoracic vertebrae. Alright, and then the xiphoid process. The xiphoid process is at the level of the body of the ninth thoracic vertebrae. Okay, so it's like that. The xiphoid process is at the level of the body of the ninth thoracic vertebra. You can see the number. Okay, it says 9. See, that it says 9. All right. Okay, so the xiphoid process is at the level of the body of the ninth thoracic vertebra. All right. So this is about the sternum, and these are the costal cartilages. We've got 10 pairs of costal cartilages. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So each of these ribs has their own costal cartilage, except the two last ribs. The 11th and the 12th ribs do not have costal cartilages. So that's why we've got only 10 pairs of costal cartilages. Okay, and that's it. Now let's talk about the ribs. As we said, we've got 12 pairs of ribs, and they are divided into 3 parts. Okay, so the first, second, third, fourth, fifth, sixth, and seventh ribs are called the true ribs because they are directly attached to the sternum through their own costal cartilages. However, the 8th, 9th, and 10th ribs are called false ribs because they are indirectly attached to the sternum. Here is why. These 3 ribs are attached to their costal cartilages, but their costal cartilages are not directly attached to the sternum. However, they are attached to the other costal cartilages and then indirectly attached to the sternum. Alright, and of course the last 2 ribs, the 11th and 12th ribs, are called the floating ribs. So they are like free. They are free anteriorly because they don't have any anterior attachment with the sternum. Until now we've talked about the sternum, the costal cartilages, and the ribs generally. Now let's talk about the vertebrae. All the way down from here to here is called the vertebral column. In the lower part of the vertebral column we've got 2 bones. This is the coccyx, and this larger bone is called the sacrum, and these are the vertebrae. Okay, alright, now the vertebra to which the first rib is attached is called the first thoracic vertebra, and down here the vertebra to which the last or the 12th rib is attached is called the 12th thoracic vertebra. And above the thoracic vertebrae we've got the cervical vertebrae. We've got 7 cervical vertebrae. This is the 7th, 6th, 5th, 4th, and 3rd. The second and the first cervical vertebrae are not shown here. Below the thoracic vertebrae, we've got the lumbar vertebrae. We've got 5 of them: first, second, third, fourth, and fifth lumbar vertebrae. Okay, so if this is a typical vertebra, this is the vertebral body. These are the intervertebral disc. So if there's a spot on this, we say that this is the intervertebral disc between the first and second lumbar vertebrae. Okay, and posteriorly, we've got the spinous processes. These are the spinous processes, and these are the transverse processes. Okay, so it's important to know that the spinous processes of the vertebrae face posteriorly, and their vertebral bodies face anteriorly. Okay, and these are if this is a typical vertebra, these are the 2 superior facets, or the 2 superior articular surfaces that articulate with the 2 inferior facets, or the 2 articular surfaces of the superior vertebra. And if again this is the typical vertebra, the 2 inferior facets, or the 2 inferior articular surfaces will articulate with the 2 superior facets, or the 2 superior articular surfaces of the inferior vertebra. And of course, here we may see the here actually here we can see the vertebral foramen. Okay, this is the vertebral foramen for passage of the spinal cord. And as we said, between the transverse processes and the spinous process, we've got lamina. So this is lamina. Okay, and between the transverse processes and the vertebral bodies, we've got pedicles. Okay, pedicles. Again here, between the transverse process and the vertebral body, we've got pedicle. This is a typical lumbar vertebra. It's the second lumbar vertebra. This is vertebral body. This is intervertebral disc, superiorly and inferiorly. This is vertebral foramen for passage of the spinal cord. This is the posterior. This is the spinous process. These are the transverse processes, and between the transverse processes and the vertebral bodies, we've got pedicle, and again pedicle. Between the transverse processes and the spinous process, we've got lamina. Okay, again we've got lamina. These are the superior facets or superior articular surfaces. These are inferior facets or inferior articular surfaces. The superior articular surfaces will articulate with the inferior articular surfaces of the superior vertebra, and the inferior articular surfaces will articulate with the superior articular surfaces of the inferior vertebra. This is a typical thoracic vertebra. This is the 9th thoracic vertebra. The spinous process faces downwards. This is the vertebral body, the intervertebral disc, vertebral foramen, for passage of the spinal cord, the spinous process, the transverse processes. Between the transverse processes and the vertebral bodies, we've got pedicles, and between the spinous processes and the transverse processes, we've got lamina. Okay, and these are again the superior fasces or superior articular sepsis, and these are the inferior fasces or the inferior articular sepsis. This is a typical right rib. So its position is like this in the body, like that. Now talking about the parts of the rib, this is its anterior end, the posterior end, and the shaft. All the way from here is the shaft. Okay. You have to hold the rib like this. This flat end has to face anteriorly. This more complicated end has to face posteriorly, and the shaft has got a groove inferiorly, so the groove has to face inferior. So this is a typical right rib. Now talking about the parts, in the posterior end, we've got head. This is head of the rib. The head has got two articular surfaces. The one below is for articulation with the vertebral body of the numerically corresponding vertebra, thoracic vertebra, and the one above is for articulation with the vertebral body of the vertebra above the numerically corresponding thoracic vertebra, and below or in front of the head we've got neck. This is neck, and then we've got tubercle. This is tubercle of the rib. The tubercle has got a articular surface or facet or facet. So this is articular surface for articulation with the transverse process of the numerically corresponding thoracic vertebra. Alright, this is all about the posterior end. In the shaft we've got angle. This is angle. See, you can see it better from here. This is angle of the rib. It's the position where the rib twist is. Alright, and then in the shaft we've got a smooth superior surface, smooth, and a rough inferior surface, which is known as the costal groove. See, this is a groove, costal groove, for passage of the intercostal vein. From superior to inferior, we've got intercostal vein, intercostal artery, and intercostal nerve. This also provides muscle attachments. Okay, and here on the anterior end, we've got a flat surface. This is facet or articular surface for the corresponding costal cartilage. Okay, so if you have a look at this here, like this. This is for articulation with the corresponding costal cartilage. And here, for example, this, let's have a look at this. Okay, so this is head. See, this is head of the rib. This is articular surface of the head for articulation with the vertebral body of the numerically corresponding thoracic vertebra. So this is the eighth rib. This is the eighth thoracic vertebra, and this is the seventh thoracic vertebra. So this is articular surface of the head of the eighth rib for articulation with the vertebral body of the vertebra above the numerically corresponding thoracic vertebra. So this is the seventh thoracic vertebra. Okay, and This is articular surface of the tubercle of the 8th rib for articulation with the transverse process of the 8th thoracic vertebra, which is numerically corresponding. This is the third plastic model. This is the pectoralis major. This is serratus anterior. This is the sternum. These are the clavicles. Okay, and this is the pectoralis minor. And these are the ribs. This, and also these. These are all the ribs. This is serratus anterior muscle. And these are its tendons of the serratus anterior muscle. Okay, and these are the costal cartilages. Okay, so there are some muscles that form the walls of the thoracic cage, and we're going to talk about some of them. We've got the external intercostal muscles. These are the external intercostal muscles. So the external intercostal muscles originate from the inferior margin of the superior rib and insert into the superior margin of the inferior rib. So the fibers will go downward, forward, and medially. However, the internal intercostal muscles originate from the superior margin of the inferior rib, or more accurately, from the lateral edge of the costal groove of the inferior rib, and they insert into the inferior margin of the superior rib. So the fibers will go upward, backwards, and medially. And we also have the innermost intercostal muscles, which are not shown here.